I've seen everything from people who, have full body rashes that resolve in the recovery room, just removing their implants. And I've seen people who have had zero issues and then hit the 8 to 10 year mark, which is time that we know that the implant shell begins to break down. The rupture rate goes up by about 0.5% every year. What it is my opinion is that because you've got that degradation, that increased degradation, that's why I see a lot of symptoms here for women around the 8 to 10 year mark who have been doing fine so far. One of my clients within 8 weeks was extraordinarily sick and had her explant at 6 months and returned to normal.
Hello, my friends. Welcome back to the show. So, this is a topic that I really believe many of you will be very grateful to hear about because there's not a lot of, I think, helpful information out there about it. It's confusing. It's just, we're talking about breast implant illness, talking about explants. It's something that I've dealt with personally. My guest has as well. So, we'll be sharing our own personal journeys and then just diving into this topic. And I hope that anyone listening walks away with just feeling more empowered around this topic, feeling like, you have a bit of clarity or maybe just some things that you want to dive more into and maybe some things you didn't think about before. Hopefully some dots will connect for you. So my guest is Candice Barley. She's an advocate and educator for women affected by breast implant illness, or BII, which she refers to as breast implant inflammation. I think that's a better name for it. Her journey to wellness began in 2018 when she faced severe symptoms like liver disease, tremors, gut issues, just debilitating fatigue. Through what she describes as divine intervention, she was led to undergo breast implant removal. The significant health improvements and hidden knowledge she uncovered fueled her dedication to empower other women in this area. She is the author of this book that's sitting in front of me, the Explant Book. Highly recommended. I think it's a really invaluable resource with this. So for Candice, she actually transitioned from her career as an actress and spent the last several years working as a patient advocate. So really holding hands through this process, even attending surgeries with the women she serves. I'm sure that was really enjoyable to watch. But she consults with women from all over the world, helping them find qualified explant surgeons, keyword qualified, and offering guidance through her book, the Explant Book, which you can definitely check out. And then her advocacy extends to her social media, which is how I found Candice, and her photo documentary, Not As Advertised, where she promotes informed consent and empowers women to confidently pursue their path to health. So Candice, welcome to the show. It's so good to have you.
Thank you so much. I'm super excited to be here. And yeah, it's incredible to be able to speak with someone who's also been through this process and who understands everything from a functional standpoint, because that is really key
Yeah.
in this whole process.
And we went to the same surgeon, right? Dr. Strawn in Newport
Yes.
Beach. Yeah. How cool is that? I found that out after actually. I did my surgery, but I'm coming on in 10 days. It'll be exactly a year since my explant. I just went in for my 1 year checkup and Dr. Strawn and I did some like different promotional videos and stuff. So that was fun. And we talked about you, which is awesome. I told him that, you were coming on the show and he's coming on the show soon too. So we'll have kind of a part two on this breast journey. But what I found with my experience was I wasn't sure if I was dealing with breast implant illness. I know that I had had mold exposure and had dealt with, I think just limbic system stuff, PTSD. I just had a lot of other things going on. So I wasn't sure how much removing the implants would help. I found that when I had them removed, a lot of my symptoms were significantly better really quickly, like my joint pain and anxiety, especially. I found that I was sleeping easier. However, what happened for me, which really sucked, was I took a course of antibiotics for an infection that was found in my breast with the explant, and a lot of my symptoms came back. So I think, I don't know if it was like a histamine issue or a gut issue. Obviously, there was more to it, but I did, it was an eye opener to me that obviously this was a significant source of inflammation for me. Removing it made a difference, but there was more to it. So I know that you're a fan of functional medicine, naturopathic medicine. Obviously, I am. That's what I do. So it's not always all just explant as the real focus. You can have maybe two people both with implants. One person reacts heavily, the other one maybe not so much, because maybe there's a difference in genetics, but also just underlying factors that maybe led to that and then the implants are just part of it. For other people, they have issues right away, right, when they get their implants. So it just does vary a lot. But we can dive more on all that stuff. I want to hear a little bit more about your particular story with this because it was kind of a spiritual experience for you that led you down this path.
It was because clearly I wasn't connecting the dots. I got implants when I was 24 years old, and I had already had two children and had breastfed, and I had very little breast tissue, and so thought it would be. I just wanted some B cups because I was so
Right.
fat. So I got some saline implants, like 225, very small, and even though it still kind of looked odd on my body because at that time they were like overfilling saline and it just looked like grapefruits on my on my little body. But I was happy because I looked what I felt feminine in clothes. And within 2 years, I had a saline rupture. And that's not uncommon for someone like me who has very little breast tissue. You then don't have enough pressure essentially on the implants. You get a lot of rippling, and that rippling breaks down the implant, and they are more prone to rupture. So I went back in, got them replaced, and within another 2 years, had another saline rupture.
Wow.
Yeah, so had that replaced. So at this point, I'm on my third surgery within essentially 4 or 5 years of my original augmentation. And something to note is that every time you do an implant exchange, you are cutting open the scar capsule that forms around the implant to
Mm.
essentially wall off the foreign object from your body. We know now there's studies that show that the actual silicone shell, remember, not remember, but important to know that all implants are silicone, regardless of whether they're filled with saline or silicone gel. The implant shell
Mhm.
itself is silicone. And that does begin to microleach and break down. We don't know how quickly that happens, but now there are studies showing that those silicone particles are breaking down and are being leached into the body. Well, they are concentrated within that scar capsule. So when you open it and release all of that, including potential biofilms, you
Right.
increase your symptoms. And that is exactly what happened to me. Now, within 6 months of getting my original first set of implants, I began to feel so tired that I went to my primary care and said, I think I might have thyroid issues. I am so tired, I can't make it through the day. Did my labs, they all came back fine. And he said, no, it's just because you have two kids under four. It's like, okay. I had two kids under two. None slept through the night, breastfeeding all night, and I was never this tired. But all right, you that was at the time that I didn't question and just said, okay, guess I need to up my caffeine intake. So
Right.
after my first rupture, um, interesting, I developed restless leg syndrome. So I'm like 26 years old, suddenly have restless leg syndrome. Went to the doctor and they're like, there's nothing we can do for that. So just lived with that. So each time I had these signs that my body was having an immune response, inflammation, but never connected the dots. Um, Time goes on. I'm, just learning to live with chronic fatigue and restless leg and, having really severe acne, go on birth control. And then silicone gummy bear implants come out. And I went back to my surgeon and said, since I've had two saline ruptures, would it be a good idea for me to do the silicone? And he said, absolutely. You're not going to have to worry about the rupture. It's going to help hold the shape better since you don't have very much tissue. So I went back in, and this is now my fourth surgery. After
Mm.
I got the cohesive memory gel implants, which they were marketing as gummy bear at the time, um, I had a significant increase in symptoms, especially to do with hormones. My hormones were all over the place. They were talking about doing a hysterectomy. We changed my birth control, doing all of.
How old were you at this time?
At this time, I was, let's see, about 32 years old.
Okay.
32, 33. And again, just different pharmaceuticals, different uh, hormone pills, different things to try to manage these symptoms, and no one knowing what's going on. um I made it about 6.5 years with those implants before I eventually started finally my labs were not okay. So I was like, your labs are okay till they're not. You go in constantly saying something's wrong. They do your labs. They say, nope, everything's fine. And we're not talking functional labs. We're talking standard labs. And so it
Like
wasn't.
what? Like what were some of the lab markers that were off?
Well, what finally was off was my liver enzymes. That's where they were the most concerned. Is my liver enzymes were elevated, but then what started happening was they were tripling every 4 weeks.
Dang.
So
Wow.
until I was finally scheduled for a liver biopsy, and this is about the time that I had the divine intervention. I was 18 hours a day in bed. I had non-alcoholic fatty liver disease, but I didn't drink. I ate all organic. I had SIBO. I had leaky gut. I had, my thyroid was just a wreck. Like everything suddenly went from your labs are fine to, oh my gosh, what's happening? And
Yeah.
I had full body tremors. I had heart palpitations. I was wearing a heart monitor. I had, the liver issues was causing me to have high cholesterol. There was just so many things happening. My hair was falling out. My skin was a wreck. So
Wow.
I my mom moved in to help me take care of my son, and because I had a young son at that time, my other two were grown, and literally in a moment of desperation, I cried out, "What is wrong with me?" And
Mhm.
heard breast implants. And I was so shocked. One, I'd never heard a voice in my entire life. And two, I had never, ever, ever considered my breast implants, which is just crazy to me now. But it just goes to show, and I now have worked with thousands of women, how essentially brainwashed we were to think that there are no issues. You're not going to have issues with implants. If they rupture, then you just get it cleaned up and get them removed. And these ones are cohesive gel, so you're not going to have a silicone mess, which is not true. But
Mhm.
anyways, I just never considered it because I'd had them for so long. And then when I went back through and looked at the timeline of all of my symptoms, it was so crystal clear. And that's why in the book, I have a timeline for you to write down your symptoms, because that's where a light bulb goes off for a lot of women. Um,
Mhm.
and so many women that I've worked with who are like, I don't think I have any symptoms from my breast implants. And then we go through all of these things that they are struggling with that are all indicators of inflammation, but they have never considered what that root cause is.
Mhm.
So I heard breast implants, immediately Googled, can breast implants make you sick? I put in my specific symptoms and found hundreds of thousands of stories like mine. And
Yeah.
so I then, started researching what's the proper way to remove your implants, and discovered that it was key to have the scar capsule that surrounds the implant removed all in one piece, which is called on bloc. And so I started looking for surgeons that did that. And I met with several who were very well known in the area for doing proper explant. And I met with Dr. Strawn, and as soon as I met with him, I knew that he was my surgeon. And I had my labs drawn because I was having to do that every 4 weeks with the condition of my liver. They had doubled again, and had my explant surgery, had my labs drawn 4 weeks from that day, and they had gone down by half. They were still way high because of where we had gotten to, but they postponed my liver biopsy and tested me again 4 weeks after that. So from 8 weeks from my explant surgery, my liver enzymes returned to normal. That was the only thing I had done. I did not
And
do
how did
any.
you feel? How did you feel after
Oh,
your surgery?
well, because of the state of my liver, I had a very difficult time detoxing from and processing the anesthesia. So for a good 2 weeks, I was still slurring my words, was drugged, like I could not get the anesthesia out of my system. But what was interesting was my full body tremors that I was having every single day. Within 48 hours, I hadn't had one. And so I was like, maybe it's the pain medication, maybe it's something else. And I basically, I'm trying to think, maybe I had one a week for the first month, and then they went away. And that
Dang.
was my scariest symptom for me, was to feel like my entire body was shaking, and then it would work its way out to my hands and feet. And I worked with an explant surgeon as an in-office advocate. And it
Mhm.
was interesting because I would go to doctors and say, I have full body tremors and it feels like it's inside. And they would be like, I have no idea what you're talking about. That doesn't even make sense. And
Mhm.
after a year of sitting in on, thousands of consultations, I heard probably about 20% of women say, I have these tremors that just, it feels like all of my insides are vibrating. And the doctor would be like, that I worked with was like, wow, Candice can tell you about that. But it was so interesting because it was one of the things that we ended up asking women. And they would be like, yes, and no one can understand or can explain what this is. And everyone's tremors go away after explant surgery.
It's so cool. I just did an episode right before this on mast cell activation syndrome and histamine intolerance. And I should have mentioned breast implant illness, but that absolutely can be a part of it. And the way that you feel with that is this just shakiness, tremor feeling, you know?
Yes.
And a lot of times it's nervous system, but a lot of times it's exposure. And I think
Yeah.
breast implants are a huge component of that. I learned something from your book that en bloc is a French term meaning as a whole in a mass. I always wondered, like, what does en bloc mean? But yeah, so we get a little French with it. I love it. But it is important, and that's one of the things I loved about working with Dr. Strawn is he's really adamant about removing the capsule. So why is that important? What's the difference
Yeah.
doing it
So
or not doing it?
right. So there's a lot of, different schools of thought. A lot of surgeons, especially breast augmentation surgeons, will say that there's absolutely no reason to remove the scar capsule, even saying that the body will reabsorb it, which is absolutely not true. I've attended surgery for where we do exploratory capsulectomies and removed capsules that have been in there for 8 years. And the issue is, and the reason that they were having those capsules removed is because they became even more symptomatic and sicker after explant surgery when
Wow.
the scar capsules, some to the point of having actual seizures. And the reason for that is there can be either those silicone and chemical components of the implant that has degraded over time. There's heavy metals, there's solvents, and things like benzene within that actual implant shell, and those things break down
Mhm.
and are within the scar capsule. Also, in 35% of women, there are biofilms, bacteria, even potential fungus. Fungus is a lower on the percentage rate that we see, but primarily it is bacteria, stuff like Cutibacterium acnes, which is just a normal bacteria on your skin. But once it's contained within a capsule in your body, it is essentially a low grade infection that your body is constantly um, trying to address. So it's just your immune system is constantly on. So if you open that scar capsule, release those biofilms into the system, you are going to create havoc on your immune system. And that's why, after going through all of this and having so much backlash from doctors and surgeons who say there's no real proof that breast implant illness exists. We can't give it it's not an actual diagnosis. But what I can tell you is that we know that foreign objects create an immune response. We know that they create acute inflammation. And we know that acute inflammation is good and normal and happens whenever your body is having a response to an injury or a foreign object. But when that acute inflammation turns chronic, we know that chronic inflammation is the root of most all illness and disease.
Mhm.
So that's why I refer to it as breast implant inflammation, because for some reason, these surgeons and doctors can somehow go, okay, well, yeah, you could have inflammation from a breast implant. Absolutely. And what about if that inflammation continues? Oh, well, yeah, then that could activate autoimmune. And that's why there is now a black box warning stating that
Right.
there have been, there is proof that there is activation of autoimmune and symptoms that miraculously resolve upon removal.
Right.
And so the women that do not get immediate relief. Now, I wasn't someone who just went immediately like, oh my gosh, I'm 100% back to my old self. This is incredible. I had had implants for 17 years. My immune system had been activated for that entire time. So I liken it to your body being a house and inflammation being a fire. And breast implants are, for many women, that fire. And so while you can essentially put out the fire by removing the implants, how quickly you recover it is dependent on how big that fire was burning, how hot, how much fire damage you have. So just because you've put out the fire doesn't mean there's not fire damage. And
Right.
some women, that is minimal, and the body is able to address that, and they do very well. But it's been my experience that for a majority of women, they need functional testing and intervention to be able to address all of those areas of fire damage.
That makes sense. I know Dr. Strawn had said, because I asked him when we were doing some videos, what percentage of women who get an explant do you find that have this miraculous change? And he said about 50%, and the other 50, it varies and it just
Mhm,
depends. He said he's never seen anyone say that they felt worse or zero
mhm.
change. There's always some sort of change. But I love that fire analogy. And I think of it as, okay, so was it the only fire? Did is the house now officially not on fire anymore? Or maybe there's some fires in some other rooms, and you just have less of that smoke happening. So that's a great, visual. And just for people to know that in order to get a black box warning, it takes a lot for that to happen. It's not like, there's a couple cases and they slap a black box warning on
Yeah.
something. On your book, you have, in your book, you have a lot of different chemicals and additives that are in the breast implant shell. So mercury, lead, copper, cobalt, chromium, cadmium, tin, titanium, antimony, arsenic, barium. I could go on and on. I mean, it's like, I don't know, probably 40 things,
Mhm.
maybe more. So that's formaldehyde,
Yep.
toluene, or toluene, acetone. Ugh, like
Oh,
it's
right,
crazy,
right. And
crazy.
so a lot of people are like, well, those are just trace amounts. Here's the difference. If you were, um, consuming something with trace amounts, if you were putting something on your body with trace amounts, which we understand all of those things are endocrine disruptors. We're talking about something that is inside your body 24/7 and micro leaching, micro releasing these particles. The issue is we don't know exactly how much. There is a recent study that I've been talking about and sharing, and they were showing that it was like 300 milligrams of silicone particles were measured per, I don't know, per month, and then at a certain point you're in the millions. And if you have a sluggish liver, your body is most definitely going to have a difficult time processing all of these things. And it's been my observation that this slow release, the sustained release of these chemicals contributes to a sluggish liver because it becomes overburdened. And now we have women who are getting in saunas all the time with their implants. And implants were never studied to be heated up beyond body temperature. And they will argue and say, oh, we sterilize implants, that we've sterilized them, we've put them in 250-degree water and they didn't melt. That is on as a whole, you're looking at it. It's the same concept of a plastic water bottle in a hot car. Does that plastic water bottle still look like it is intact and not melted? Of course. But if you are to test the water inside that bottle, you are able to see that chemicals from the plastic have microleached into the water. Same.
Right. And you're not going to sanitize lead or mercury out of
No,
something. No.
no, no. So yeah, I am a proponent of telling women that they should not sauna with implants. I have seen total toxicity tests on women who regularly sauna with implants, and their levels of chemicals that are comprised within the implant shell are off the charts. And then after explant, with zero detoxification protocols. We like to do cell core, but with zero protocols of detox, those levels are not even detectable at 3 months.
Gosh, it's crazy. That's so crazy. We talked about a lot of different symptoms, and it does depend on the woman. Nobody's the same exactly, but what are, just the most common symptoms that you see with breast implant illness?
Yeah, absolutely. The first most common and oftentimes overlooked is fatigue.
Mhm.
It's the first sign that your body is working. So, chronic fatigue, joint pain, headaches, you start struggling with just other symptoms of inflammation. So, it can start presenting as headaches, brain
Mhm.
fog, these are neural inflammation, hormonal imbalances, thyroid issues. There
Yeah.
really is. What's interesting is I've seen everything from people who have full body rashes that resolve in the recovery room just from
Mhm.
removing their implants, and I've seen people who have had zero issues and then hit the 8 to 10 year mark, which is the time that we know that the implant shell begins to break down. The rupture rate goes up by about 0.5% every year. And what it is my opinion is that because you've got that degradation, that increased degradation, that's why I see a lot of symptoms appear for women around the 8 to 10 year mark who have been
Mhm.
doing fine so far.
Mm.
But one of my clients within 8 weeks was extraordinarily sick and had her explant at 6 months and
Wow.
returned to normal.
Mhm.
One of her symptoms was excessive urination within,
Mhm.
going to urologists, and no one could figure out what was wrong within
Mhm.
24 hours of explant.
Yeah.
That stopped. So yeah, just it's really dependent on how your body responds to inflammation. And one of the things I talk about a lot, and was a key factor in me just taking my healing and overall wellness to the next level, was understanding my genetics, doing a DNA test and looking at my main genetic detox pathways. And what we found is that women who have between 2 to 4, there's four, but 2 to 4 of those that function suboptimally are most likely to experience symptoms with breast implants. And I am all for
Of course. Yeah. Yay.
it.
Is there a certain company or panel that you like to work
Yes, I
with?
love the DNA company because they're so comprehensive. It's very easy they have an app where you can actually integrate all of your results and shows you exactly how you need to eat, what supplements you need to take. So for me, those four main pathways for people to understand are vitamin D, how you optimize and produce your own vitamin D, uh, glutathione, which again, suboptimal. So no wonder my liver got to the state that it did. Antioxidant, and then of course methylation. And so many have MTHFR, and not being able to methylate, and then you have the issues with glutathione. It's just a perfect storm. So
Mhm.
there's a lot of testing that actually should be done before women get breast implants to determine whether or not they're more likely to experience a lot of issues.
So besides the genetic tests, which ones do you think are important to do prior to explant?
Yes, there is a company called, they're mostly used for dental, but it's called Biocomp. And to
Mhm.
be able to basically see how your body responds to these different components of the implant, nickel being one of them. I can't wear earrings that have nickel. My ear swells up, and so many women have that issue with nickel. Well, when you have an implant that has trace amounts of nickel in your body all the time,
Yeah.
the women that I see a lot of times who literally, these are the ones that wake up in recovery and are like, I feel amazing. And
Right.
I would be in recovery with them and I'd be like, well, you're on pain medication. There's these things. And they're like, no, my neck doesn't hurt. There's all these different things. And then, of course, follow them. And that truly is from the moment they woke up. And that is someone that is having literally an allergy, a sensitivity reaction to the implant itself.
Mhm. My experience after having my explant is I was able to reduce my thyroid medicine a lot.
Yes.
Um, I also dropped like 20 pounds. I didn't do anything different.
Yep.
Just, and I know Dr. Strawn said that too. He sees weight loss as a common, change post explant. And then I'm 4 months pregnant now. Maybe that was a factor. I'm 44, I mean,
Incredible. Yeah.
so naturally got pregnant and I was thinking, I mean, I was seeing a fertility doctor just to get some labs done. And she was saying, your labs look amazing, but you should probably get IVF, probably because there's nothing else she could offer. But, because of your age, I was already pregnant during that appointment. Didn't even know.
Amazing.
So,
That's
but I do think I don't have a crystal ball. I have no idea if that was a factor, but I would think so. I
I
think,
can tell you, again, having worked with both a surgeon that had worked with lots of women and then me working with lots of women, that women who had severe infertility issues, including going through IVF and with no success, have explant surgery and are pregnant within 8 weeks. So seen
wow.
that numerous times. And the same thing with thyroid medication. We started having to tell people like you need to have your thyroid labs run within 4 weeks because a lot of women suddenly everything's more bioavailable. I
Yeah.
explain the inflammation caused by breast implants for a lot of women become a brick wall. So HRT, thyroid medication, even supplements and different things that you're doing are blocked. They are not bioavailable. It's very difficult. And then as soon as that wall comes down, suddenly all those things work really well. And there's even been women who have gone into a thyroid storm from their normal dosage of thyroid medication within 4 weeks of explant.
Yeah. Yeah. I had symptoms. I was like, this is too much thyroid medicine. I do not need this.
Yeah.
So that
Yeah.
was really encouraging because it feels, I mean, for a lot of women who deal with hypothyroidism, it feels like they have to keep going up and up in dosage. But
Yeah.
you get to the root of those issues and address those. It doesn't have to be like that.
Exactly.
So yeah. I know that there aren't any specific tests that can confirm or rule out BII, right? It's just more of a
No,
collection
I
of
mean, and
symptoms and
a lot of them will try to go with the, CRP and say, okay, if you have elevated, C-reactive proteins, then maybe then that's showing that you have inflammation. Well, that's not the case. Both my friend and my best friend and I had explant 2 weeks apart. We had completely different symptoms. She was being hospitalized for migraines that she had never had in her entire life, except for the 7 years that she had implants. Again, never
wow.
connected it. And I had put on about 40 pounds. And I am having, full body tremors, can't get up. We both were in bed all day. We had zero energy. And so, so she had super high CRP levels. Mine were perfectly normal. My liver enzymes were through the roof and hers were perfectly normal. So
Mhm.
again, it's that just how your body responds to inflammation and your genetics. So she doesn't have the any of those issues that I have with my immune detox pathways genetically.
Mhm.
So within and she also was struggling with she had always had depression and anxiety, but was controlled easily with medication. None of
Mhm.
that worked. And I see that a lot where you get treatment resistant depression or
Yeah.
anxiety through the roof. Um,
Mhm.
Within a week of her explant surgery, she hadn't had a single headache or migraine. She had already dropped like 7 pounds, hadn't done anything different, and she wasn't she wasn't struggling with all of the symptoms of depression. And
Wow.
so her normal dose of medication began working. Within 4 weeks, she had dropped, I think, 20 pounds. Again, had done nothing different and not being able to exercise, not doing anything. It was just inflammatory weight. And we are now both 6 years post explant. She hasn't had a single migraine.
That's
Not,
crazy. That's just crazy.
yeah.
One of the things I love that you talk about in your Instagram are ways to go about the process of explanting in a healthier way, ways to help support recovery. I really appreciated that. You had recommended a few things like the Renew 28 gel. So I use
Mhm.
that.
Yes.
And then the ASEA,
Yeah.
whatever it's called.
Redox. Yeah.
Yeah,
Yeah.
so I use those. So I'd love to hear about that. So, just any supportive therapies, detox strategies, supplements, that you find are helpful post explant.
Yeah, absolutely. So I really like the ASEA just because it's bioidentical redox molecules, which is what your mitochondria make, which are, it increases your NRF2, which is your healing response. And I just found that I actually have women a lot of times start that prior to explant, just so their body is acclimating and increasing their redox. And then afterwards, doing it every few hours because you're supporting your body as it is actively healing. And then the Renew 28 is just basically a gel form of that. And by applying that to the breast after surgery, once your surgeon has cleared you to do so, you are helping to restore homeostasis, especially to do with blood flow, which is compromised after you have, lidocaine and all of the things injected that are meant to reduce bleeding. And then, of course, cutting on that area, as well as the tissue, the fatty layer, especially of the breast, is uh, compressed from the implant, from years with the implant. And it acts
Mhm.
like a slow releasing memory foam that is going to fluff to some degree. But it's been my experience that applying the Renew 28 multiple times a day can help with that, expediting that fluffing process, as well as
Mhm.
helping to reduce the numbness that can hang around for a really long time. I've even had women who have been able to restore their nipple sensation that had none since getting breast implants. So that's where I've just been super, and it's completely non-toxic, 5-star rating from Bioagiletics, and so it's just a really great thing to be proactive in your healing process. And then another product that I absolutely love is glutathione, but there's one in particular that I've discovered. I met Dr. Patel, and this is a transdermal glutathione that basically is more powerful than IV, than injection, than liposomal, because it actually gets in the red blood cell versus all of those that only get in the plasma. And glutathione is very important for helping your body detox from the anesthesia. So
Mhm.
I found that women are. I wish I had known about that during my explant surgery, because knowing that I'm suboptimal already with that, and most people are who are over the age of 30 are would benefit from glutathione. But this
Right.
one in particular, now that I've worked with so many women and they use it afterwards, snap back really quick. That brain fog and just that feeling of being drugged that can last, especially if you've been struggling with a lot of symptoms, really resolves quickly using the glutarol.
So what's it called? Glutarol?
Glutarol.
Glutarol. Okay,
Yeah.
we'll put a link for all of these. And then for people who want to get the ASEA or the Renew 28, probably just go to your Instagram or your
Yeah.
webpage.
Yeah. Or my website.
Okay.
I've got things there. And then, there's just essentially making sure you're living a low inflammatory lifestyle. So, of course, not eating processed foods. Generally, I say just avoid dairy and gluten and all of those things. If you haven't done a food sensitivity test, a lot of those things create inflammation. So, just while you're recovering, let's cut those things out. Of course, no alcohol. And then, really increasing your protein intake after surgery is very helpful to get your body out of the catabolic state and into an anabolic state where it can heal
Yeah.
faster. And then, of course, proper hydration, not just drinking lots of water, but making sure that you've got a good electrolyte balance, but not just doing a bunch of the high salt like elements and stuff, because of course that can make you swell and you're trying to
Right.
going to a minimum.
True. It's a balance. I went
Yeah.
and had lymphatic massage after, and she was working on like the scars and stuff. Do you find that helpful?
Absolutely.
Yeah.
I like for women, if possible, to go get a lymphatic massage by. It's got to be a certified lymphatic massage therapist the week of. like within 3 days or so afterwards is very
Mhm.
helpful, feels very good to help move fluid out. They're not working on your breast, they're just opening lymphatic throughout the body. Or even doing a device like the Balancer Pro is really helpful. Makes you feel much better and helps to move all of that.
What's
Um,
that? What's the Balancer Pro?
yeah, it's incredible. It is a device that is a lymphatic massage device that um they have a jacket and they have a lower pantsuit that you lay down and it does all the work. You put the jacket
Okay.
on first, it's going to open up everything. It has no pressure on the front. It's on the sides and the back and on the arms. So it opens up your lymph system up top, and then you put the pants on, and it works all the way up your legs and up your abdomen and feels really good. You urinate a lot afterwards, and it just helps to move that post surgery fluid out of your system and a lot of that inflammatory water weight that is ready to leave. So
Right.
yeah, lymphatic massage, amazing. Especially if you can do it the first 2 to 4 weeks after surgery. That's great.
Mhm.
And a lot of women get great benefits from doing hyperbaric oxygen therapy afterwards. Even if you can just do 1 or 2 sessions, that's helpful. A device that I really love is called the Avicen, which is a microcirculation device. And you just put your hand in it. It has a negative chamber that dilates the vessels in your hand. Your palm is on a warm, dry heat plate, and on your AVA here. And so essentially what it does is creates microcirculation through your whole body, including the tips of your fingers on your other hand and your feet. And now I have clients using this after explant surgery, and they are healing so rapidly that their surgeons actually ask for my number to find out what in the world they're doing.
Wow, that's so cool. And
Yeah.
also infrared, right?
Yeah, infrared is great, if especially if you have one at home.
Mhm.
I don't love for women to go to like a wellness center and unwrap and do that, lay on a bed or anything the first few
Yeah.
weeks afterwards. It's best if you have your own red light panel at home. You can use a small one. And then yeah, those are the main things. You could get
Great.
into some therapeutic peptides. Those are very helpful afterwards. I've had really good success with women doing even just BPC oral afterwards, or TB4 Fragmax. Some of those have been really great for
Is
extra.
that something people have to work with a practitioner to do?
Generally, yes, but
Yeah.
I have a company that I work with that is actually a peptide clinic out of LA, and Dr. Holtorf is the doctor that oversees all of that, and they are the only company that I personally trust that is direct to consumer oral therapeutic peptides, and they're
Love
called
it.
integrative peptides.
Okay, cool. I'll have my assistant make sure to get all those put those in the show notes because that's really juicy stuff.
Yeah,
I love
yeah,
it. And the thing is, our bodies are healthy, they're designed to heal, but there are ways to help that process and to make it happen, maybe quicker, a little bit
yeah.
more comfortably, assist with.
Yeah, and I would say, so one of the things that I really encourage the women that I work with, and I have some surgeons, or doctors that I refer to, and you're one of them, is functional care afterwards and testing. So the testing that I like women to do that is most beneficial is a GI map to look at their gut, a total toxicity to see the levels of mold, environmental exposures, BPAs, those types of things, and of course, heavy metals. Um, if they are open to it, a food sensitivity test like an all cat 250, so you can really see everything and remove the things that are in their severe and moderate profiles to help lower inflammation. And then, of course, the big one is the DNA test from the DNA company. Those are the
Mhm.
things that I like women to do, and I feel like really gives a good. And of course, a regular. Most of them have all had their labs done and know where they're at with that. If you want to look at your hormones, those things are very helpful. Your thyroid, of course, but from a functional standpoint, looking at those tests, addressing the gut, and then supplementing according to your genetics, I found to be like life changing.
Absolutely. Yeah, I would throw in micronutrients,
Yeah.
checking like glutathione levels and all of that. I think
Yes.
those are all really important. Oh my gosh, I love this. Well, we flew through time-wise. I could talk about this all day. I know you could too, and you do talk about it all day. Are there any final thoughts, anything else that you want to leave listeners with that we haven't touched on?
More than anything, I've always wanted to. I never want to fearmonger. I never want women to feel afraid. My whole purpose in sharing all of this is so that women have the information. I don't feel like I had informed consent because I would have removed my implants a long time before I got to the point that I did. And I see this with women over and over again, is that it was never on their radar. And I just want women to have that information. So if they are struggling with symptoms, if they have looked into and tried everything else with no resolution, that they have that information and go, oh, okay, well, it's time to consider that it may be my implants, and have the education and knowledge to go forward in how to properly remove their implants. And then if they are wanting to get breast implants, knowing the different testing and things they need to look at to determine whether or not they're a good candidate. Yeah.
Right. And how, I wouldn't think that anyone getting implants, that there's probably not one woman who has 0% reaction or 0% inflammation. There's going to be something going on, whether you feel it or not, at a cellular level.
Yep.
And one thing we didn't touch on is just the emotional component to this. I know women can feel very emotionally connected to their implants because they feel like they're a part of them. They feel like they're not going to be attractive after. That was one of the reasons why I chose Dr. Strawn, because it was part health, but it was largely cosmetic. And that
Yeah.
man is like a breast just artist, because he didn't start as someone who just did implants. He was doing reconstruction for women post cancer. So, and he doesn't really do implant surgeries anymore. It's really about explants and just making the breast look beautiful again. He did such a good job. I
Yes.
probably would have waited to do the fat transfer. I know you talk about that a bit. Probably best to wait, see what they look like, and then decide from there. But that's one way that you could, make them larger later if they feel like, you don't like the shape or the size. But just knowing like I love the feeling now that this is naturally me, and
Mhm.
it did change my body. I guess just my view of my body image, confidence. I felt like there was a positive that came from it, that I didn't really expect. Did you experience that?
100%. And I had a fat transfer about 2 years after my explant, and I had no breast tissue. I had adhesions. I had, not aesthetically pleasing breasts, but I wouldn't change that time that I lived with that, because
Yeah.
I there was so much spiritual growth that happened, and reconnecting with my body and being in tune with my body. And that is one of the gifts in this whole process. And as difficult as having your breast implants cause severe issues and then have to remove them, is you learn to be connected and in tune with your body. And I know how things affect me, and if I do something and then I suddenly get a breakout or whatever, I'm like, that is connected to this. And then I can alter the things that I'm doing to really live a healthy life. And it was just until I went through that whole process, I didn't realize the connection and how everything affects my body.
Right. Yeah, absolutely. It's a whole journey. And did you feel like you retained the fat from the transfer pretty well? I don't
Yes,
know
so
that I did. I don't
this is
know.
my second. I so some women, yes, I say you can do fat transfer at the time of explant. It is my opinion, and I just think that you should stage it out. I feel like from my experience, women have the best results when they stage it out. You still have results doing it all together, but better when you stage it out. I did 2 rounds of fat transfer, because I was only able to do a small amount each time.
Hmm.
And I am 3 months post op my second fat transfer, and I've retained about 90%. Now,
Wow.
I feel that big part of that was because I was using the Avicen and having incredible circulation. And that device has been shown to improve take of stem cells by 30%. And when you are doing fat transfer, it's adipose derived stem cells all throughout that fat. So I was like, I think this would. I found it at A4M, this device, and I was
Oh,
like,
that's cool. What was the percent? It just cut out for a brief
oh,
second.
sorry,
What?
it increases by 30%.
Okay.
Anything that you do when using this device. So a lot of stem cell doctors were using it and had a 30% improvement in take with women, or not with women, but anyone using the Avicen. And so
Mhm.
I was like, okay, well then that would make sense that fat transfer would improve, and it most certainly has. I would say so normal fat retention, you're great if you can get 60-70%. That's considered a
Mhm.
good retention, but I'm at 90%. So the numbers
Wow. That's so cool. Well, after I have my child and finish with breastfeeding and stuff, I'm sure I'll revisit the fat transfer,
yeah.
stage. Well, Candice, I loved all of this. This is so helpful, and it must be so just satisfying and fulfilling what you do because you're helping so many women. So thank you for all of the time and work that you're putting out there, and and being generous with your time with us today. Really appreciate it. And yeah, for all of that you do. We are very grateful because you are making a big difference. So thank you.
Thank you so much. It's an honor to do so. I started this whole journey of sharing with the hope of being able to just help one person, and I've
Mhm.
never could have imagined what that would turn into. And it's
Yeah.
definitely, um, you know, it feels like an important purpose, and I'm just yeah.
Yeah. And it's
See
going,
how it
from
all was divinely orchestrated now.
it is 100% from pain to purpose. So for people who want to follow what you're up to, it's Holistico Life, which is Italian for holistic, right?
Mhm.
Okay, Holistico. So Olistico life. And it's also holisticolife.com, right? Is your
Correct.
website?
Mhm.
Awesome. So you guys can, learn more about her there. Follow along. I love watching your Instagram. I just think you do such a good job. I feel like I'm just like hanging out with you all day and learning and, geeking out. So yeah, so follow her there and have a wonderful day. We'll talk to you soon.
Thank you.